Okay, so yeah, Linus has kindly introduced me as well, but I am a research nurse at Lancashire Teaching Hospital, and I'm currently on secondment with NHS England. And sorry, I don't tell my name. My name is Deepsi Khatiwada. So my talk today is around reaching underserved community, patient and public research awareness and engagement. And this was a small project that was done initially, but I'd like to share with you the journey that the project has taken. So in this presentation, I'll share some of the findings from the project first, and then I'll go on to discuss about some of the progress we have made. So just before we go to the project, just wanted to bring a bit of a background around why we undertook this project. So we know research active organizations have better patient experience, better outcomes, and hence better organizational performance. And therefore, it's of no surprise, research participation is one of the key focus of NHS Constitution. However, we do know that recruitment and retention of research participant is a significant challenge. And what we know also is that participation from ethnic minority communities are less in the clinical trials or research. Poor engagement and recruitment reduces external validity and generalizability of the findings. So going from this background, we have various policy drivers that influence this, including NHS long-term plan, NICE guidelines, research for best health, and many more documents. So with these kind of drivers and policy support, we started our project. Initially, to start the project, what we did was we did a 5-year retrospective audit. And when we talked about underrepresented group initially, with this project, the main focus was ethnic minority community. So what our 5-year retrospective project showed was we had a vast majority of participants recruited as being from white background. For others, data was either not recorded or not reported. So we had a group which was unknown as well. So going from here, we had now to design our project, and we went on to design the aims of our project. So the first aim was to establish the baseline understanding of research awareness and engagement amongst patient and public. And our second aim was, once we devised a baseline understanding, we wanted to see an increase in engagement of about 10% from people from Black and Asian minority population. And we also wanted to find out opportunities and barriers for research participation and strategies that influence recruitment to research. So in order to undertake this project, we did it in a multi-phase process, and it was a cross-sectional survey, which was designed by actively involving patient and public group. And we incorporated questions around demographic profile of the participants, experiences, opportunities, and barriers. So with the multi-phase, in step 1, what we did was we looked at our research database, and this has about 2,500 to 3,000 participants. And once the participants was identified, a research nurse phoned the participants, and a survey link was sent to the participants. And we did this exercise for 3 weeks. And 3 weeks on, after a lot of hard work, guess how many participants we got? Only 8. So then we moved on to our second phase. And considering this is a project work, we had 12 weeks to actually actively start recruiting the participants. So in the second phase, what we did was we linked up with our in-house communication teams, and we used to disseminate the survey via in-house communication teams. In the second step, we also linked with clinical teams across the organization, like medics and nurses, to help disseminate the survey. So going on from this, 3 weeks again down the line, how many participants we've got? 324 participants. And this was a really good result. We were really excited, and we thought we could start analyzing our results. But when we start analyzing the results, what we noticed, vast majority of our participants yet again, reported to be from white backgrounds. So we have 92% of the participants responding, saying they're from that background, about 8% of the participants from non-white background. So there were a series of ideas. We're trying to find out, what do we do next? How do we do that next? And how do we improve the participation or engagement of the ethnic minority community? So this led on, obviously, to a wider organizational engagement activity, because we had very limited resources and we had to use the resources that we had. So this linked me up and my team with the inclusion and diversity team within the organization, ethnic minority forums. We went to patient experience group. We had PAYM champions, and this linked us to local community groups and leaders. We had South Asian women's group, and we have lots of opportunities for snowballing. And this obviously feels like it was an easy exercise, but we had a lot of work to do around. And we had lots of people interested in this work. And after this, we also worked very closely with the team, and we started putting the poster. If you see in the middle, that was the poster that was designed with the QR scanner code. And we had a link for people that took them to the survey. We posted the survey online via closed WhatsApp group, Facebook group, but we also went and put the posters around the temples, mosques, supermarkets, etc. And sometimes we were just sat on the supermarkets distributing the survey. But yes, obviously, this has been a highly digital survey. We try to provide paper versions to some people, those who asked for, but this was limited. So 3 weeks down the line, when we started doing this massive community engagement activity, how many participants we've got, but obviously considering we also have other engagement exercises still open. 476 participants now. So we went up to 476. Looking at that again, have we really shifted the dial? So let's see what the impact has been. This obviously was before the 3-week tailored engagement activity. And this is after the engagement activity. And yes, we did it. A massive shift in engagement from 8% to 32% in just 3 weeks. And we were really pleased, obviously, with the result. And before I move on, I just want to now share some of the findings from what the participants have said, and I'll be very brief with those findings. So what our question was, it was very simple, generic PPI question, research in 1 word or sentence. So we had a group of people saying new medicine, treatment, procedure, some telling research as a miracle or solution, some talking about experiments, and some groups saying, eek, guinea pigs, lol. So we kind of captured the wide audience. And we asked what motivated them to take part in research, and majority of them said they wanted to help others. And the second common was, it was general interest in research. So in experiences, we asked people, what was their experience of taking part? People said, feel reassured that my antibodies are still detectable. Some talked about benefits of taking part in research, like I'm having regular blood tests. Some talked about total lack of communication between departments, resulting in constant delays and missed appointments. Research nurse was the only person to keep us constantly and correctly informed around communication. And another participant said, participation saved my life. And moving on from there, we asked them the barriers of research participation. And at this stage, we wanted to divide between participants who are from white background and who identified themselves from non-white. Both groups said lack of research awareness as a common barrier. But when we moved down, majority, there was a vast difference around stigma, language, family, friends, and societal pressure amongst 2 groups. So more than 50% of the participants from non-white group rated that as being higher. This is a quote one of the participants shared with us. They talked about being cultural barriers in participation in research, and if they do take part, they can be stigmatized by the community. Now, moving on to the recruitment strategies, we also asked what would influence our recruitment strategies. And again, both groups talked about user-friendly patient information leaflet, and I think that has been echoed in all of our talks this morning around accessible information. What was highlighted was there was a significant difference between the two groups around greater cultural awareness amongst healthcare professionals. And also recruitment via community faith centers were rated slightly higher amongst non-white group of population. So these are simple findings from our study. Just wanted to talk some of the limitations of this PPI engagement activity. Obviously, it was conducted in Lancashire and South Cumbria and a single geographic location. As I said earlier, we are also heavily reliant on digitally active population. And this study was conducted during COVID-19 period, so we had very limited face-to-face engagement activity. So next steps from here. Within the survey, we asked our participants if they would like to work with us in raising awareness about research. And we had 125 participants saying that they want to work with us to raise awareness. And we had a diverse group of audience here saying that they want to help with the work. So second phase, we're looking at developing cultural competency framework for research. Third, we're working with the local team to put ethnicity as a key performance indicator. And fourth, raising awareness around via presentation, meeting, conference, because I think it's raising awareness that brings us all together. And we are also looking at data linkage around how ethnicity can be linked with our research database with the wider organizational data, so we can do a bit of data sharing around that. So what this study obviously concluded is labeling populations as hard to reach is a misnomer. Study highlights the importance of population-focused recruitment strategy. And the study also proved that well-designed engagement and awareness campaigns with active involvement of patients, community organizations, health and social care are essential to achieve equitable and accessible participation in research. With this, I just want to move on to the progress that we have made from this study. So the progress so far, obviously I said this study was taken as a part of a project started in July 2020. That was when the offer letter to undertake the project was given. Another 2-3 months or so, there was a time where research operation local clearance was undertaken. And by January 2021, the study was complete. So the next phase was writing up, sharing findings, etc. Around that phase, when in January 2021, the project was completed, there was a great engagement around the organization. And what this study also showed was leaders must reflect the communities they serve. So this led us to link up with the organizational team, including the exec board, and we designed an inclusive leadership program at Lancs, and it was a leadership opportunity for the ethnic minority staff. And we had to take this positive action because the findings did show, and there was wider evidence to support this as well. Going from there, this wasn't research specific leadership program. It was a general leadership program. We had huge interest, but what we lacked was we needed somebody in the research to drive that in a similar way. So this led us to working together with the senior team, designing a business case and forming a research inclusion lead role. We managed to get interim funding for the role to drive the agenda forward. With the inclusion lead role, this allowed time, protected time, but also opportunity to be visible in terms of inclusion in research. And within that role, we promoted the inclusion work in research in various platforms, including Nursing Times, UKCRF conference. So there were few areas where we started promoting that, but also slowly trying to adapt it around Northwest. Once that was happening, there was another opportunity, obviously, with the lead role. We were trying to develop the lead, obviously, and it was me doing that role at that point. Moved on to nurse inclusion lead as a secondment, which I am at the moment. But as we have already discussed with previously, sustainability of EDI work can be a challenge, and we didn't want this to be a one person's role. So when the shift of the workforce shift happened at that time, we again designed another business case, and led to development of EDI internship program within the organization with the funding that we had already. So at the moment, we have 3 EDI research interns undertaking the what next that we discussed earlier on work. And we are also looking at our local strategies and policy, which is in development. We're trying to make the strategy which is tangible and which the metrics are tangible. And that is our work in progress at the moment. So with this, obviously, that we are still there, a huge journey. We're still learning, and I'm sure more to come. But this has been a really good team effort, and I just wanted to thank everybody who has helped me with this work. And thank you for listening to me as well today, everybody, and I'll be happy to take any questions.